So now before you mentioned that there are aggressive prostate cancers and non-aggressive or indolent prostate cancers. And you made mention this notion, the way we understood it in medical school, hopefully this is still true, is that most people who have prostate cancer, they don't die from the prostate cancer, but they die with it eventually, because at some point we all do. Do you agree with that statement still?
To a certain extent.
Yeah.
And we can, based on the biopsy results, we can tell to some extent whether this seems to be a more aggressive or a less aggressive cancer. So there are many cancers that have pathological findings, so essentially the way that the cancer cells look under the microscope, we can tell that they don't look very aggressive, and we're becoming much better in those patients of saying to saying to them, well, maybe we don't need to treat this. Maybe we can just sort of watch it closely and make sure that over time that this doesn't develop into a more aggressive cancer. Meanwhile, there are some other cancers that, based on how the cells look under the microscope, we can tell that these are very aggressive cancers and probably have a high likelihood of eventually spreading or metastasizing. Prostate cancer can spread to the lymph nodes or to the bones. It can cause severe pain. It can cause problems with also just locally urination, and it certainly can cause death. And it was the rate of death from prostate cancer was relatively high, and before we had good PSA screening tests, was certainly did have the highest death rate among cancers, or did have the highest death rate of any cancer, mortality rate we call it. Biopsies are very common. We can do them just in the office, just with local anesthesia, so we don't have to put people to sleep. We don't have to put people under sedation. It's quite a minor procedure, very comfortable. So the concern about the biopsy doesn't need to be too emphasized, I think. Yeah.
So in other words, if somebody has an elevated PSA and there's some risk, it's really a good idea to get the biopsy, and then they can know whether this is just a benign lesion that needs to be watched gradually over the years, or if it's something that needs more serious treatment.
Correct. So the biopsy procedure is very critical for us to understand, is this a dangerous prostate cancer or is this a less dangerous prostate cancer? And from there we decide everything else in terms of treatment or no treatment, or close follow-up, which is called surveillance. There are very rare complications with biopsy, like infection, like difficulties with urinating, but thankfully, and due to different things that we do, including giving certain antibiotics, these issues and complications are pretty rare.
Okay, it's good to know. Thank you.